In general, I look at my role in this relationship as like a co-passenger with the patient to try to, steer them in the right direction so that we can get them to our, anticipated goal, whatever that may be. In certain situations, our goal is to get rid of the cancer. So, my job is to try to help steer them and give them the best guidance and treatment to try to get them to get the cancer to go away. And those that, the disease are more chronic and this is a long-term relationship, whereas, we know the cancer will come back. My goal is still sort of the same, but it's sort of situated a little bit differently and sort of trying to manage expectations and sort of ease the concerns of patients in some regards to when we have these times when, your disease won't be treated, but I'll still follow you and still manage you and still sort of watching out for you, but you're not necessarily actively doing anything, and sort of make the patient more so comfortable with the aspect of, the cancer is more a chronic disease at this point instead of something that's the big C word, whereas everybody freaks out and thinks that something just has to be done. A lot of that is, based on the simple fact that, I've been on the other side. I know, how it feels to be a family member of a patient. And, it's not easy, especially it's a lot of, misinformation and things that you don't know. There's always a possibility of giving too much information, which, is information overload, and too little. You always want to find that happy medium where you give the patient enough information in regards to the disease so they're well equipped to know what they're dealing with, and makes the visits, the future visits, a little more comfortable, going forward, and not so much anxiety inducing as some of the visits can be.